Okay, why don't we go get started with introductions? Somebody want to help with that?
Absolutely. I'm happy to help out.
Thanks, Brad.
Perfect. So, now flip list. We'll start off with just to save time. We'll have chat members introduce themselves, and we'll have everyone else go ahead and introduce themselves into the chat. We'll go ahead and we'll begin with Brad and Amay.
Brad Porterfield, I'm the chair of the Community Advisory Council.
Hi, my name is Amay. I'm just a CAC member and a community member.
Perfect. Next, we'll have Stacy and then Myra.
Hi, my name is Stacey Shaw, consumer representative.
Maida Tabayot with Family Resource Center and Consumer Rep as well.
Perfect. Next, we'll have Miranda.
Good afternoon, all. Miranda Hill, she, her pronouns. I am with Klamath County Public Health.
Perfect. And I believe that's all we have right now for CAC members. Am I missing anybody? All right, I think we're good to go ahead and get started.
Thanks, Brad. We have a volunteer who would like to read the land acknowledgement.
I can read that, Brad, if you want to.
Doesn't matter.
Oh, wait, Michaela has her hand up. I don't know.
Oh,
There we
where'd
go.
she go? Michaela?
I was just saying, 1 minute, let me put it on the screen.
Oh, okay, got it. Okay, all right, here we go. Land acknowledgement. We recognize and acknowledge the indigenous land of which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yukaskin. We acknowledge them as the past, present, future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass to the children.
Thanks, Myra. Okay, just a quick reminder about our meeting practices. We do our best to be welcoming and make this a comfortable environment for everyone to participate as you choose to. Please feel free to speak up and listen carefully to everybody else when they speak. Be respectful. Use simple language. Do your best not to use acronyms. We want to all understand each other. That's pretty much it. So welcome, everybody. Is there anybody who would like to share a public comment or a patient story?
I'd like to share something on behalf of Kina Chadwick, who is the new Director of Programs for Gender Hive, which is an organization that advocates for quality and access of healthcare for trans, non-binary, and gender non-conforming adults, youth, and families. In addition to some new programming that they're rolling out in October, they will be having a conference about evidence-based best practices for gender-affirming care that will be held at the River House. More updates to come.
When did you say that is, Avery?
I believe it will be in October.
October.
But I will get confirmation when Kina comes back from PTO, and I'll be happy to share that information to the GAC and beyond.
All right, thanks. Anybody else who would like to share a patient story or public comments? Okay. Go ahead and move on to announcements. I don't have any announcements. Avery or Michaela or
I have
anybody else?
announcement.
Okay, go for it.
All right, so the first one is that Dr. Ari Powell is our new executive director, which we are so excited to have her. And she has a long history of serving communities and a huge depth of knowledge in healthcare and healthcare leadership. And so I also wanted to pass it off to Ari if you want to share a little bit more about yourself.
Well, thank you all, and thank you, Michaela. Yes, I'm very excited to be here. I am glad to be back in Central Oregon, and that I'm so that the council offered me the opportunity to be back here. Central Oregon is home for me. I was born and raised here, and did spend the last 15 years going to school and working in other areas. And I'm very happy to be back, being able to bring all of the kind of experience that I've had in healthcare back home, to really be a part of improving healthcare here in Central Oregon with my community. So thank you all. Some of you are involved in some of the interview process of the community and such. So thank you very much. And I'm excited to be here. Thanks, Michaela.
Thanks, Ari. The second announcement that I have for you is that Avery is now taking lead as the lead program manager for the Community Advisory Council. And she also has a huge passion for community engagement and has fresh ideas, new ideas, and I think will be really beneficial in supporting this group. So I am not going away, but I will be stepping back kind of more so in the background. So Avery, she is your point person.
And happy to be so. And thank you so much, Michaela. I don't know if everybody knows that. How many years, Michaela, have you been the CAC coordinator?
Like 9.
9 years. Goodness. So thank you so much for your consistent and dedicated service. And Michaela and I are working closely to make the transition as seamless as possible. And parts of it will be bumpy because CAC is bumpy and complex and a fun little sandbox to be in with all of you. So I appreciate your graciousness and patience. And I'm also very grateful to have the opportunity to be of service to you in your work.
Thank you. All right, I have a few more announcements. One is about the Regional Health Improvement Plan build. So you should have received an email inviting you to join the building process. And this would be building out the content that's in our next plan. And so that's like the aims, the measures, the background, the strategies. And it's a really important time to have your voice and knowledge and elevate the voice of the community within the work and within the plan. We are going to hold these meetings in person, and there's going to be 5 of them total, and we are going to rotate throughout the region. These meetings will also be about 2 to 3 hours long, maybe a little bit more. And this is to really take you all through and the community through a strategic planning process, really being mindful and going through it with a lot of intent. So an invite for you to participate if you would like to. We will have lots of supports available, stipends, reimbursement for mileage, childcare reimbursement, things like that. Deadline to RSVP to join these building sessions is tomorrow. If you would like to join and maybe misplace the email, just contact Avery or myself and we can get you that link. Any questions? We will have an orientation webinar on the 26th to share that information in more detail.
Michaela, do you know who did that email come from?
It will come from our info account.
Oh, okay.
All right, so let us know if you're interested and can't find the RSVP link. Next announcement is about our 2020 through 2024 RIP, Regional Health Improvement Plan celebration. We are coming to the close of a cycle and we are inviting all RIP work group members, our Community Advisory Council, and our board to come celebrate all the work that has been accomplished these last 5 years. And so that is Thursday, September 5th. It's a luncheon in Redmond. last reminder is that we have our first site visit, our grant site visit with Seed to Table, and it is coming up on September 19th from 5:15 to 6 p.m. at their location in Redmond. So mark your calendars. And that is all I have.
That was a lot. Thanks, Michaela. Any other announcements? Okay, we are going to, oh no, we need to ask our CAC members. Hopefully you have all had a chance to read the notes from our June meeting. And this is your opportunity to speak up if you see anything in those notes that doesn't represent what happened or any questions you have about the notes. So we kind of, if there are no questions or comments and so forth, corrections, then we consider them accurate and approved. But this is your chance to speak up if there's any questions or corrections you'd like to make. Okay. Hearing none, the notes from our June meeting are approved as accurate. Is everybody? I believe we're moving on to our breakout sessions now. Who's going to set this up for us? Is that Brad?
Absolutely. I'll go ahead and get that set up. So what we're gonna do, our small breakout session today is gonna be focused around dental. We're gonna have the discussion of what outcomes do you hope will be achieved from the dental ad hoc committee with the board and the CAC, discussing possible improvements like wait times, broader access, more providers accepting OHP, that kind of thing. For groups right now, we'll be able to put all our CAC members into one room. We'll have one room of 5 for CAC, and then our support members will have a separate room of 4. So we can go ahead, we can get that rock and roll, and we'll see you guys back in, I believe, about 10 minutes. Does that sound good? All right. Staff will be out in the main room. If you're having trouble with access or need some help, feel free to reach out or come back out to the room and we'll get you a place. See everyone back in about 10 minutes.
Well, hopefully those of you who were discussing this topic had a good discussion. And we get a little bit of time right now in our agenda to bring what was shared together so that we all understand what discussions we had and we can consider how we move forward. Is there somebody who would like to jump in and share? What your group talked about? Anybody? There was 2 groups, is that correct?
That's correct. We had 2 groups.
Okay.
Well, our discussion was top secret, so we just got to leave it at that. Okay.
Yeah.
Okay, you spoke up. What do you have to say?
Actually, is the Anna or Anne from VIM? She brought up a slightly separate issue that's important, not the topic for dental, but she's finding that a lot of the folks she interacts with when they go to St. Charles, there seems to be maybe a little bit of a mix-up on the insurance status or payer or whatever, and then it brings in very confusing bills in front of them. So totally separate topic, but maybe one to discuss from a different day. Regarding dental, I don't pretend to be an expert at all. You know, we have a dental director who leads almost all of our dental discussions and discusses with the DCOs. I'll point out that it seems in Central Oregon, I don't have that much visibility to other regions. You know, the dental team, you know, has a lot of leadership that show up, right, at the board meetings, at PEP, at a lot of the health council events, probably RIP work groups and things like that. So I think that's a real plus. And maybe that will help whatever solution is needed. Maybe then it would make it a little easier to have the solution in Central Oregon. It seems the likely solution. I mean, there's two problems, right? Problem number one, is there just enough dentists in general? Probably. Though I think even for folks with commercial insurance, sometimes it takes a while to get in for cleaning or whatever, but probably, at least in Bend and Central Oregon in general. So the problem's probably not enough for taking OHP, right? And it's probably not that hard to figure out why they don't take OHP. I think there's two reasons why. More do not keep appointments. So how to solve that problem. And the dentists are great at, you know, giving those reminder texts. And I mean, they've just kind of mastered that. So I'm not really sure why that is an issue. And then of course the payment rate. So a lot of problems can be solved by paying more.
Thanks. And who is that dental director at Pacific Source?
Oh, Kyle Ash.
Kyle Ash. Okay. Thanks. So I guess I'll jump in for our group. We had a lot of similar topics were touched on, where the perception is definitely that we need more providers. And I'm glad you clarified who accept OHP. Because yeah, there probably aren't plenty of dentists, but not plenty of dentists who are serving our OHP members. And yeah, those reasons you brought up are reasons that were brought up in our group as well. Some other things that were shared. So as far as like the workforce, getting people into that workforce, having scholarships available to get more people in the dental workforce, Spanish speakers in the dental workforce, and some questions around how interpretation works when it comes to dental services, if that's working well or not working well for folks who choose to have an interpreter. There's some mistrust of providers out there. Don't know to what degree, but there's some mistrust of providers. Mobile clinics are great, but they're kind of infrequent. Those are more frequent, especially in Northern Klamath. That would be great because transportation is also an issue, getting to appointments for folks who are in the outlying areas where there are no providers in their communities, or very few. That was brought up. I have an idea to have something like, I might get this, not express this correctly, so correct me if I get it wrong. Voucher, something like a voucher for out of network, to go to an out of network provider, even if there's the understanding that you might have to come up with something out of pocket, a little extra, pay something out of pocket, just to, I think, have more flexibility for access. As far as our process and working with the board of directors, it would just be great to get a really solid understanding of how the whole thing works. Like there's still a little bit of lack of clarity as far as how the dental care organizations work and how those relate to the providers. So some of them are actually providing services directly. Some of them have providers underneath their umbrellas, maybe, like we don't exactly 100% understand. And then sort of from what I've seen, there's very few providers who accept ODS. So for folks who get put in the ODS underneath their umbrella, there don't seem to be very many providers in the network that accept that as compared to Advantage and Capital. And what else? Help me out, folks. Did I forget anything? Or is there anything new anybody would like to add?
I just want to remind, because maybe not everybody was there, but during the joint CAC and board discussion in June, following the selection of the health topics, Christian Miller Anderson made a really in-depth presentation about many of these issues and others, and also clarified some common misperceptions. For example, that OHP members aren't reliable, they don't show up, but there's so many other extenuating circumstances that is also sometimes on the provider's side, as well as some of our CAC members were there and shared their lived experience with it. And so we can send out the slides from that presentation.
Yeah, that would be helpful. Thanks, Avery. That certainly seems like an obvious first step. So maybe we use that presentation when we come together with the board to just kind of get a grounding, make sure we kind of answer some of those really or most fairly basic questions about just how everything is designed to work. Oh, and then hearing more from our members. It feels like we do have a little bit of member voice from the community survey about dental, but not much. Doesn't feel very rich. And even we don't want this like to get drawn out and take forever necessarily, but it's process. But it sure feels like it'd be helpful to hear from more members. So if we can work that into our process somehow, I think it'd be great. Nothing super expensive, but maybe it's inviting members to one of those sessions or something. We could think about that. Anything
Yeah.
else? I feel like I'm forgetting something that somebody shared. Harry?
Yeah, is it I wanted to also give a little bit of an update on the ad hoc committee with the board whenever we're done, making sure, want to be sure that everybody shared their pieces from the breakouts first. And then I've got a bit of that from the council perspective and some next steps there to share with you.
Okay, how about let's give like 20 more seconds, or at least some space.
Absolutely.
Give CAC members one more chance. If anybody has anything you want to share. Okay, go for it, Ari.
All right. Well, thank you all for expressing your concerns about this and bringing those topics. And it was good to hear from me for the first time some of this. As you know, I'm brand new to the council, just joined about 2.5, almost 3 weeks ago now. So I'm just starting to learn some of these things and hear about some of the challenges and opportunities we have around dental care in Central Oregon. So thank you for bringing that. I'm looking forward to hearing a little bit more of that and reading through some minutes to make sure that I really have a grasp of what you're bringing. I did want to let you know, and I think you know this, that the board, as you know, in I guess it was June, did approve that there would be a dental ad hoc committee working with specific board members from the Health Council. And we're really committed to doing that with excellence and doing that in a way that's going to be collaborative and really build a community and a connection between the CAC and the council board. And to that end, we are also in the middle of a really intense cycle of building the regional health assessment, the health improvement plan, as we've already talked about some of these meetings that are happening over the next couple of months to build all of that. And so we're looking at how all of this fits together and how we can do all of this to the highest level of excellence and include the right members, whether it's the CAC members, the board members, really include people who are going to be able to pull together a great group, get some great information, and make some really actionable steps, or create some actionable steps to do something in this space. So with that, we are planning on building this, something that I'm going to be taking on, learning a lot about, working with our team here of the program managers to build over the next couple of months this ad hoc committee to be launched over the next couple of months with kind of as we're also launching our RIP and as we're publishing that information so that we can get this done all together so that we can get this done again with excellence. I want to be sure that as something that that I'm leading and I'm going to be a part of with the CAC team here, that I do it with excellence and not just brand new. So I'm asking you for a little bit of understanding of where we're at in our process building the raw and the RIP right now, as well as me being new in this and saying this is really important and far too important to rush through or to get done without that level of excellence that the council is committed to. So we're going to be developing this over the next couple of months alongside you so that we can get really actionable steps quickly, meaning that by the end of the year, we will have this committee formed and really up and running. And it will take us a couple of months while we're doing the raw and the RIP as well. So I just wanted to give you that update and say thank you very much. And I'm excited to be able to really dive into this and learn with you as a group on building and being a part of this committee.
Thanks, Ari. Appreciate that. Are there any final comments on this topic before we move on to our community health projects discussion? Okay. Michaela, take it away.
All right, I'm going to ask Brad if he can share the slides. Thank you, Brad. Okay, so you all launched the community health, go back to the first, thank you. So you all launched the community health projects back in June, and we are getting down to the review time. So those applications should be submitted at the end of this month on the 30th. And for the next couple of months after that, you'll spend some time reviewing each application and making decisions on those grants. So what we wanted to do this month is give you a little bit of a preview of what to expect for that review process. Next slide. Thank you. And just a little bit of a refresher. It's been a couple months since we talked about it, and we have some fairly new faces in our group. So just a reminder, the community health projects, the CAC invests a little over $2 million each year, depends on the year, but into the community for projects that address social determinants of health. So when we're thinking about social determinants of health, this is everything that affects your health that's outside of your typical medical office. So being able to have housing, being able to have access to fresh fruits, being able to breathe in clean air. Those are things that are social determinants of health. And also focus on health equity. So everyone having an opportunity to reach the highest level of health that they would like to achieve. And you all within the community health projects also wanted to focus on projects that met basic needs, that focus on prevention, that served rural communities, that were created by and for these specific communities. And these projects also have to align with our current regional health improvement plan. Next slide. All right. Another reminder, last couple of years, including this year, you divided up those community health project funds among the county and the tribal nations that are within the CCO service area, and you divided those funds up based on the poverty rates. And so when you receive those applications will be broken up by county, and each county has their own award pool. We did receive updated numbers. I think we're receiving just a little under 2.7 million. And so these numbers will adjust based on that amount using the same methodology. Next slide. Okay, so here is the timeline. Like I said, the community health project applications are due at the end of this month. And so you will receive the applications by September 4th. It will come in an email, so you'll receive an email with a link, and within that link will be a spreadsheet that has the name of the grant, the link to access that application, and a link to submit your scores. And so you'll use the scorecard that you created and approved back in June to help rank the applications. And I'll show you what that looks like in the next slide. But while you're reviewing, we're going to ask that you review the Northern Klamath applications first. Similar to last year, we're going to have you make a decision on the Northern Klamath applications at your September 16th meeting. Sorry, your September 19th meeting, and your scores are due the 16th. And then you'll have up until October 10th to review and score the remaining applications, and you'll make a decision on funding for the remaining counties on the 17th of October. You don't need to write this down. It'll all be in an email. We're also happy to meet with you separately and talk through this too. Any questions about the timeline overview? So applications due the 30th. You'll receive the information to review and score the material by the 4th. We're asking you to review the Klamath County applications first and make a decision at your September meeting, and then review and score the remaining applications and counties and decide on the rest at your October 17th meeting. Okay, let's go on to the next slide. Brad, if you have the slide deck, it might just need me, but I cannot see it.
Yeah, I do. Let me try sharing it again, see if it comes up.
Okay. Folks, let me know if it's just me. Okay. Everyone can see the slides? Okay. All right. So within the email with instructions that you'll receive, there'll be a link to the spreadsheet. This is the one from last year. And so within it, then the first column is where you'll click to submit your scores for the application. And the second column is the organization that submitted the grant, and then a link to that application. The rest of the information to the right is just additional information, just a quick look at kind of the highlights of that grant. And then at the bottom, you'll see that we have grants for Northern Klamath all on one sheet, and then you can click over to the other Excel sheets or other tabs to view and review the other counties. If you would prefer to have this all in paper copy, we are happy to give those to you, to send those to you. You can have the paper score sheet, as well as we can print off paper applications. Just let us know. Just get in touch with Avery or myself, and we're happy to arrange that and give it to you. All right, next slide. Please feel free to stop me if you have any questions.
Michaela, just real quick, just in case there's folks who don't use Excel all that often, if you could go back and just show the tabs at the bottom for the different counties.
Yeah, so if you look down at the bottom left side of your screen, you can see like a 1, and then Northern Klamath is in green. That's where the tab is. And so then if you follow that over and click on the 2, Crook County, you click on that, all of the Crook County applications will show up. And then same for Jefferson County and Deschutes County. All right, next slide, please. Okay, and so this is just a copy of your scorecard that you're going to be using when reviewing and scoring your applications. And the questions that are linked within the survey that's in the spreadsheet will follow these same questions. So you can either use the Google, the survey link and or this paper copy to score those applications. All right, next slide. All right, we are providing grant review stipends. And so it's a little bit different than last year. We're asking that for every 5 applications you review, you can receive a $25 stipend for reviewing those applications. And we'll give you an additional $50 stipend if you review all of the applications within that county. And then if you review all of the applications with all the counties, we'll provide an additional $225 stipend. One thing to be aware of is that the stipends can affect your income and eligibility for Medicaid based on the income requirement. So we ask you to be mindful of that. And you can accept some of the stipends, none of the stipends, all of the stipends. It's up to you. And we also have an option for you, if you want to avoid the stipends altogether, to receive kind of a gift equivalent. And we were thinking of providing like a gift basket with different goodies in it that would be probably equivalent to the same dollar amount. How does that land with folks? If you are thinking about the gift equivalent, what are some things that you might want? You can invite you to come off mute.
Michaela, could that be like gift cards to like a grocery store or like gas gift cards?
The only thing with gift cards is with the option of doing a gift equivalent, the stipends and the gift cards are reportable for income. And so we were kind of thinking of a way to get around that. Like different food baskets. I don't know what would, you can throw some ideas in the chat and we can try to come up with something. Groceries.
Is there, sorry, and I just joined. This is Martha, Health Equity Strategist for Pacific Source. But do you think there would be a way to partner with a grocery store and say, we'll pay a lump sum amount and give vouchers to people?
That's an idea to explore. Yeah, we could do that. We can explore the idea and let folks know.
Stacy says in the chat, I'm paying for a Costco membership, question mark.
Yeah, we can explore that too. Other ideas? Okay, we'll explore the ideas. Feel free to pop more ideas into the chat while you're here today, and we'll collect those at the end of the meeting.
Well, the last thing to say about these, the way it's changed from last time, is we wanted to make it as approachable and as accessible as possible. So in the past, you had to review at least 10 to get a stipend. 10 can be out of reach for some folks depending on the circumstances of our lives. So we're doing it by increments of 5 instead. We also did like an aggressive cost of living adjustment, even though it's not a ton of money. It's, you know, we're still struggling with inflation, and our area in particular has experienced over 9% you know, greater cost of increase compared to the rest of the nation. But I just want you to know that we brought all of those things into consideration in terms of how much we could budget to offer folks and how frequently we could offer things for folks, because we deeply appreciate your work in this.
Thanks. All right, so I'm seeing strong support for grocery stores and groceries in general. All right, let's move on to the next slide, please. Okay, so we are sitting at August 15th, and so there are 15 more days for folks to submit their applications, and this is where we're sitting right now. We only have one application in draft for Crook County. We do, however, have 7 in draft for Deschutes. We have 3 in Jefferson and none for Northern Klamath. And so we would like your help in promoting the community health project grant opportunity, possibly forwarding the information about this grant opportunity to your contacts within these areas. Miranda, we've reached out to Echo down in Northern Klamath, but if you have more connections or want to, would be willing to outreach in that area too, that'd be greatly appreciated.
Absolutely. I'll reach out to a few folks. We went there for a listening session. They had a lot of ideas, so I will do that after this meeting.
That's awesome. All right. And then ideas for Crook County. Or folks willing to reach out to contacts there. And we'll do focused outreach in those counties as well, but it would help if other people have also outreached.
Michaela, I think just from last year working in Crook County, it took a lot of encouragement and reassurance to get people to apply there. I know a lot of the feedback that I received was essentially, you know, well, what are the odds, or like, what's the point? So I would just encourage that if staff reach out, to just be mindful that sometimes it takes a little extra encouragement.
Okay.
And Crook County on the Move is always a really great place to get that info out.
Thank you. All right, we will reach out to them and be mindful of that. All right. Avery, did you have anything else before we move on to your section? In grant support?
Yeah, and so if we go on to the next slide, we can talk about that. So that was a whole lot of information, very dense, been a long time in the making. Maybe actually move your body and stretch a little bit, and I invite you to do that while we talk very briefly about this. But I invite you in the chat, maybe just say, you know, 1 being the lowest, 5 being the highest. How confident and prepared do you feel to effectively, quickly, adequately review grants? Just first number off the top of your head. No judgments or anything like that. I'm just curious. So we're getting some 3s, some 4s, some 4.5.
Out of what, Avery?
Like 1 to 5. 5 being the highest, 1 being like, maybe I've never done it before and I'm not sure, you know, all of which are okay. So, you know, the CAC is made up of a diverse grouping of folks, some of which have a lot of experience reviewing grants, some that have less, some that are new to it, some that maybe feel a little rusty or something like that. So I just wanted to very briefly talk about a few supports to help folks review grants to the degree that they wish to. Next slide, please. So a couple different offerings. After this meeting, I will be sending out a CAC grant review guide, and it's just some best practices, some real simple things to acknowledge verbally that I'd like that, yeah, it is a big responsibility. It's a special one, and, you know, honor that you're doing that. Like, in my opinion, this is one of the great contributions that you get to make as a CAC member in helping to determine where funding can go for the projects that reflect the values that you have, as a group, have chosen. And the other thing I just want to mention from that, so the scorecard reflects this a lot of things that the CAC decided this funding cycle around is important to them. And it was projects that, you know, meet the characteristic needs of people being served. It was for and by communities that are experiencing health disparities. They're culturally and linguistically responsive. They serve folks in rural areas. They promote equitable access. These are all sort of your guiding principles, and I wanted to package all of that in an easy to use sort of reference guide if that's useful to you. So I will send that out. As well, I'll be available for one-on-one or small group office hours to support you navigating any aspect of the grant review or scoring process. And another thing that can be really helpful is, like, have a buddy, you know. Can meet in person if you live nearby or have similar schedules. And another thing that we can do is, with our Zoom accounts, we can also arrange sort of a virtual meetup of 2 or more CAC members. And that, if that's helpful and encouraging for folks to review in tandem at the same time. So those are just a couple of possibilities to help folks through this very in-depth but very significant process. Any comments, concerns, or additions or other types of supports that have been or would be helpful for folks? And if anything comes forward at another time, by all means, please email us. So you can look for that review guide soon. Next slide, please. All right, so we have been talking about CAC membership recruitment and diversification and equity and getting as much representative voice on the CAC as possible. So we've been talking about this at almost every CAC meeting consistently on purpose. So we're going to talk about it again. And the way that we're going to do that is, it's been a little while, you know, we took a month off, so we're going to update on our current updated CAC member demographics because we have new members and it is different. We're going to review the recruitment goals that the CAC came to in the past and kind of see where we're at with those goals. You guys also, in small groups, came up with some preliminary possible strategies that CAC members could take on as individuals or groups to try to recruit potential CAC members from our underrepresented or totally unrepresented demographic groups. And the hope is that today we can get some potential volunteers to take on the responsibility of at least one strategy to try and get some of that representation and the word out. Next slide, please. So this is from our CAC demographic report that Pacific Source sends to OHA. We can go to the next slide, though, make it a little simpler to see. So we have 13 total members, and 8 of them are consumer reps or OHP members. We do not currently have any Indigenous tribal members. You can see the number of self-identified folks based on their self-identified race, as well as age, differences in ability or accessibility needs, sexual orientation as self-identified, and then other demographics such as English as a preferred language, which is different from English as a primary language. Next slide really quick, please. So we can always come back to those numbers, but with those numbers in mind, very briefly, in the past in these discussions, the CAC had agreed to start. We looked at the demographics of our region and our counties as a starting place, and that's what's called proportional representation. That is not equity, of course. We know that just because the demographics are a certain way, that doesn't actually mean that there has been, equitable representation historically or currently. So it's a starting point as we aim towards more equity. As well, that the CAC can be as large or as small as it needs to be at a given time. And so whatever number of folks of different groups from different parts of our region that we need in order to get the most diverse participatory voices in the CAC, you get to have that. And it, of course, doesn't mean replacing any members that are already participating. So we're building a longer table is the intention. Next slide, please. So with all that in mind, the CAC together came to the following as intentions for recruitment. So in terms of age, CAC wanted to seek to recruit at least one new member between the ages of 16 and 24, or a caregiver of someone of those ages. In terms of language, the CAC wanted to try to recruit at least one new member who does not identify English as their primary language, as well as at least one member who uses ASL or other experiences around communication differences in ability. As well, at least one member who has a lived experience with or can appropriately represent the experiences of folks who have been uninsured or who struggle to maintain their OHP insured status. At least one member who openly self-identifies as trans or non-binary. And interestingly, one member that identifies as a cisgendered man, if we're going by proportional demographics of Central Oregon, even though cisgendered men tend to have more privilege in our society, we also need their voices to be able to meet those needs as well. We don't want to leave anybody out. Sexual orientation or relationship style, 1 to 2 members who identify as LGBTQ+, etc. And then at least one potential additional member with a different form of ability. Next slide, please. At least one person who identifies as Black, 1 to 2 additional members that identify as Latinx, and at least one additional member that identifies as Asian or Asian American. Others to consider a veteran member, a foreign-born member. And at the time, we did not have any members, for example, from Crook County. We could use more from Jefferson County, Northern Klamath. The vast proportion of our members tend to be Deschutes-centric, but focusing on recruiting members who are rural Deschutes instead of urban Deschutes, and of course, building greater relationships with the tribes in our regions. So that was a whole lot. Next slide, please. So with all of that, you all went into small groups and talked about what inroads folks already had, what ideas they had to potentially outreach to some of these underrepresented communities if they wanted to represent their communities on the CAC. So in the Klamath area, some folks talked about Spanish radio and the Health Council down there to outreach to folks of Asian descent, API organization events, as well as at the time there was an upcoming talent show. We I'm not going to go through and read all of these proposed strategies, but they are in your packet, and we will send them on as well. But I'd like to go to the next slide because it's kind of the most important and in the interest of time. So we've talked about where we might want to go and why. We've talked about who's here, who's not here, who we want to reach out to, how we might do that. And now we're at a place where are there folks who are willing to volunteer to at least be the lead on seeking to reach out and potentially recruit new members from these different categories? So this is the opportunity for folks to self-reflect. Is there anybody in the meeting today that feels called or has unique inroads into potentially reaching out to like our younger age demographic in our region for CAC membership? Does anyone feel called to that one? Can come back to that one. How about reaching out to folks who do not identify English as their primary language? Brad Porterfield? Great. Does anyone want to, so this is just as a lead. Other folks can join as well. It's not that just one person. Is there anybody who is interested in joining Brad, or you can get with Brad through the chat? In the interest of time, does anybody feel called to or have special inroads or experience of reaching out to folks who have complex experiences with maintaining their insurance status and getting that type of voice on the CAC? So rather than going down through all of these one by one in silence together, if at this time you feel called or have the ability to outreach to any one or more of these specific categories of potential members, could you either come off mute and say so, or put it in the chat, or both?
Avery, this is Miranda Hill with Klamath County, and I will happily reach out to folks in northern Klamath County, and I also have some good relationships with our Klamath tribes. So I'm happy to do some outreach there.
I deeply appreciate that, Miranda. Thank you. Anyone else?
So I would work with Teresa for the Jeffco initiative, and then independently for the Rural Deschutes.
I'm sorry, Rural Deschutes, and what was the other?
Jefferson.
Jefferson.
And Teresa's at a conference in Arizona right now, who usually represents Jefferson County Public Health. When she gets back, I'll meet with her and we'll come up with some game plans.
Thank you so much. Really appreciate that. Yeah, CAC leadership on this is incredibly important. Of course, you know, COHC staff, you know, really endeavors to do this, and we've sent out, you know, flyers in multiple languages to OHP members. We're working on some other strategies around media and things like that. But y'all are in your communities, and if we would like to have this broad and diverse and fuller representation, it does require effort and participation on CAC members' parts. Without belaboring it any further, are there any others? Stacy says Facebook posts are great and easy to share.
Just a quick comment, Avery, so that this doesn't feel too overwhelming. There is the possibility that, at least the way my mind's working, about 4 or 5 of these could all be one individual. one individual could represent 4 or 5 of these categories. So
Absolutely.
yeah.
Yeah. Yes. Thank you for mentioning that. Yeah, these are kind of artificially pulled out, right? It could be a young non-binary person from Jefferson County or something like that. We just kind of artificially pulled them apart because some people have more of an affinity or relationship with certain types of identities. So this is just an exercise. And Miranda says, can share out recruitment letter to our Spanish radio station. Thank you so much for doing that. Deeply appreciate that. Any last contributions? Crook County Latinx community, thank you. And you might not know today, you know, your availability, your capacity might change in time. And this is something that we're just going to have, you know, regular, you know, shorter discussions about. This is like kind of a, you know, where have we been, longer discussion, and that we won't have to do each time, but always seeking to evolve and have more equitable and just representation on the CAC. So thank you so much for that. And if there are other things that come to mind, feel free to reach out. Next slide, please. All right. On to the fun stuff. My apologies if you are tired of hearing of my voice already. Who has heard the term microaggression? Hands up. Who, in their own words, even though we sent out some information prior, how would you describe what a microaggression is to someone who has not heard this term? Any volunteers? Who has maybe suffered a microaggression or unintentionally committed one? Yeah, that's thank you. Most of us have, especially if we have identities of more relative power. Microaggressions are the things in between that harm our capacity to relate and work together when we bring diverse communities together. And so I wanted to, it's a very complex topic, actually. It's highly subtle and what have you. So what I'm going to do in the remaining time of the meeting isn't by any means going to do it justice, but we're talking about it because it is part of our commitment to always evolve and refine our practices in all of our groups to make them more just, more equitable, more diverse, more inclusive, more accessible, more safer feeling, safer being, and more cohesive. And so we can think of this as a way that we can take care of ourselves and ways that we can be in solidarity with other people so that we can both be and feel safer in communities. Next slide, please. So here's two examples. Connor, are you still with us? Would you be willing to read example A?
I can try, Avery. A white male assistant professor at a college tells a friend that someone mistook him for a security guard. When asked how he felt about it, he says, "It was no big deal. It was kind of funny."
Thank you. Michaela, would you be willing to read example B?
Sure. A Black male assistant professor at the same college tells a friend that someone mistook him for a security guard. When a friend asks how he felt about it, he says, "I'm sick of it. No one here sees people like me as what I am. I'm a professor with a degree who teaches.
Thank you so much. Next slide. So what's different about these experiences? They seemingly have had, quote, the same experience. Someone made a mistake, made an assumption. But what is different?
I'll jump in. The one thing that stood out is the frequency of how often it occurs for each of those individuals. It sounded like it occurs much more frequently for the Black assistant professor than the white.
Okay, so frequency, kind of cumulative effect of not being seen or being assumed, a negative assumption about someone based on their identity. What other differences?
I would also say the perception, right? So the white male assistant didn't think of it as a big deal. It was nothing, blew it off, while the Black male assistant professor did see it as a big deal and, you know, felt that more. So I just think, yeah, the perception was definitely different there. Of the
Yeah.
intent. The perception
Yeah,
of the intent.
Totally. The experience was different. The longevity of the sensation of harm is different. That can go along with maybe that's the first time that's ever happened to that white professor. Maybe it's the 18th time it's happened to the Black professor. We don't know. Anything else? Any other differences in that example, or from your own lives or your own things that you might have witnessed as well? These happen all the time. Any other comments? Carol, can I put you on the spot?
I thought you might. Yes, when we were discussing this at a staff level, I explained that I hadn't realized that for 8 years I've been working for a gentleman who saw me as a female and not with any brain. And the microaggressions just accumulated. And towards my end of my working with that gentleman, I began to get antsy, and it built up. It did build up over several put downs, and the fact that I was missed out, and I wasn't counted for my job or my role. I was counted as a female, and I was working in a very male industry, the Catholic Church, and was made to feel very much the female in the room who didn't count for anything. So when it came to leave my job, actually, it was those sorts of aggressions that made the difference between, do I stay in the valley or do I move to the high desert? And I think the progression of those over 8 years of being put down certainly made my decision easier to make, in that I couldn't wait to get away in the end.
Thank you, Carol. I really appreciate your vulnerability and willing to share that, and that sort of aha awakening that you had, having some terminology for your experience, because you knew how it felt, but maybe didn't quite have the words for it. Next slide, please. So I come from a medical background, and we talk about signs and symptoms. And so symptoms are the things that we experience inside, and signs are things that can be observed from the outside as well. And so there are certain general categories that we can use to determine, man, have I just been the recipient or the victim of a microaggression, or observing someone else, like, oh, did I unintentionally commit a microaggression here? Or, oh, I saw that interaction between those folks in this group. I'm curious about that. So some of these that we saw in the example is there's a feeling of hurt, right? There might be some uncertainty within the person who feels hurt, like, am I making too much big deal out of it? They start to question their own perception. And one of the reasons for this is that microaggressions are often unconscious. So, which is different from like an insult or in a direct attack, right? They're harder, they're more nuanced, they're more difficult to identify. An important dimension of it is that that comment or how that person acted was related to the social or cultural identity or experience of an oppression that the other person had. So in Carol's example, that was around gender and maybe some other dimensions of identity. In the other example, it was around dimensions of race and education and maybe socioeconomics and what have you. But they cut deeply, and because they can accumulate, it's like that term folks have heard of, like death by 1,000 cuts. As well, it's likely that the person who committed the microaggression, this is a distinguishing one that you can use for yourself or for others. Would that person have said or done the same thing to someone else that they perceived as having more power over them? So in the example that Carol graciously gave, would that person have said the same types of things to someone that was or that he perceived as his boss? What do you think, Carol?
I can say clearly that I brought something up in a board meeting, which I had previously discussed with the chair and been snubbed on. When the chair of that board brought that same thing up, it was taken as read. So I didn't count, but they did, which was quite a hurt at the time. But I was pleased that the chair had taken my comment offline, as it were, not in the meeting, and brought it in, and it was actually adopted in the end. But it came by a convoluted route, and it does really make you cross at times from an administrator side point of view, then when somebody doesn't listen to me. But I had no idea that's what this was. Now I see it laid out. You can understand what's going on.
Yeah, thank you, Carol. Yeah, and that's the importance of making it said. All of these examples have the effect of either instantly or over time, both deeply harming individuals, but also the spaces that they share with others become increasingly emotionally, spiritually, somatically unsafe and harmful. And this is how even well-intentioned groups that want to come together to do work together can unintentionally break down in their ability to do this because it's not being identified or it's not being addressed that these things are happening. Next slide, please. So, as we talked about, they're hard. They're hard to pin down. They depend on the context. They also depend on the power dynamics in spaces. They're often unintentional. So this again is where we are differentiating intent versus impact. We're not talking about whether someone intended or not. We're actually assuming best intent, and yet we can still have a harmful impact on people that we care about and that we work with. Microaggressions are much more likely to come through folks with identities that have more relative power in a situation. And so that's important to self-reflect on as a member of a group. Next slide, please. So the other thing that is important to note, and then we're going to be wrapping up because it is a very complex topic and I want to respect your time. It it doesn't just hurt that it happens. It also hurts that it could happen many times, and it hurts exponentially when it is observed by other people in the group and no one else in the group disrupts it or tries to address it in solidarity with that person. Has anyone witnessed an experience where someone, maybe unintentionally, said or did something that was clearly harmful to someone? You saw the impact on that person and no one said or did anything? Has anyone been in that experience? So my personal experience in talking to people who have had that experience, the group not identifying, not knowing how, or not being willing to address the problem was often the most painful or the most isolating part of that experience. And so that is the reason that spaces come to be not welcoming, non-inclusive, and harmful for folks, especially those living with marginalized identities. Martha says in the chat, having to educate people after being harmed as to how and why it was harmful is draining, for sure. This is a collective effort. This is the beginning of a conversation so that we can start to institute some of this awareness and shared awareness and practices and language, because it is tremendously draining to educate someone, especially if you were the person that was harmed. That shouldn't be that person's responsibility. Next slide. So, ways to check to make sure they maybe don't commit a microaggression. Don't comment on social identities or cultural groups that you're not a part of. Poking fun or making comments on those groups that you probably wouldn't say about groups that you're more familiar with or are part of. There's that compounding harm that I talked about the witnessing but not addressing. And I want to propose this as a community opportunity and responsibility to both notice when it happens and also to take responsibility as individuals and as a group for disrupting and addressing them when they happen. Next slide, please. In the interest of time, let's actually go one more slide. So you can read these on your own. Sorry, one more slide even. Thank you. So at the beginning of CAC meetings, we talk about having shared agreements, right, and practices. And this is one. Has anybody heard of this practice or technology? It's called Ouch Oops. Anybody? Hands up. A few folks. So in order to actually heal and evolve together, it's more useful to call in rather than call out, right? We're not simply trying to shame. We know that shame doesn't actually lead to wholesome evolution or change. But there are ways to call in folks so that we can identify and note that something has happened so it doesn't get pushed under the rug and that it doesn't get forgotten, and create space later to address it in a useful way. So the way an example could work is, say I'm talking and I unintentionally say something that could be construed as racist or something. Say there's it doesn't even have to be a member of that particular racial community, but like if somebody noticed, wow, that's kind of racist, they could just say, ouch. And then we all just stop, breathe. Me as the person who spoke and was disrupted with the ouch, that's my opportunity to take that in and make a self-commitment to, okay, I might not totally know why that might have been harmful, or, oh man, I didn't intend it or whatever, but I'm going to examine that. I'm going to take on that responsibility. I'm going to ask for help. I'm going to do my own work to look at why my comment might have had that effect. And I'm going to take responsibility for that learning. And other members of the group can choose to support that or not. That's their choice. In response to it, I say, oops. So I say something that could be construed as racist. Someone says, ouch. Rather than me getting defensive, rather than me trying to explain myself, I didn't mean it that way, or blah, blah, blah. I just say, oops, acknowledging it, knowing that I will do the work. And then we can move forward, because in that space of the immediate harm, it's often not the best time to most skillfully address the issue, because there is some educating and some research and other practices that can come in. Does that example make sense to folks? Any questions? Has anyone done it before? No? It's really helpful because it allows people to stop, notice, feel, but there doesn't have to be a debate. There doesn't have to be an explanation. There doesn't have to be more labor on the part of the person who had been harmed, for example. And anyone can do this. And so then it becomes a technology that anyone in the group can do in solidarity with someone who might have been harmed, even if unintentionally, so that we can heal the inevitable missteps that happen when we bring together people from different backgrounds and we try to collaborate together against the backdrop of the realities of like histories of harm in our culture. Thank you for your attention. That was a whole lot of information, a whole lot of time, a whole lot of my voice. Is there anything that folks want to say, comment, share at this point in time before we wrap up?
Just that you don't need to apologize, Avery. Probably wasn't enough time.
Not enough time for the thing, but it's a long time to be on Zoom. It's a long time to hear the same voice. So I deeply appreciate your attention, particularly to this issue, because it is something that in my experience and a lot of community organizing can really make or break whether people stay in groups, whether groups can function well, whether that cut continues to get deeper or healing can happen. You can actually build a sense of connection and solidarity and power together through just the inevitable mistakes that we make because we are human beings.
Thank you, Avery. I really appreciate you being willing to bring this to us and teach me. So thank you. This is lovely, and I look forward to using it when necessary.
I think that's all she wrote.
Thanks, Avery. Is there anybody who would like to share anything in the next minute? I appreciate everybody staying on a little bit longer than we had planned, but if you feel there's anything you want to share before we part, we give you that space. All right. Thanks again, everybody. We will see you in September.